Hello friends, I am Dr. Deepesh Prajapati, pediatric dentist from India. I am here once again in front of you to discuss about space maintenance. Many of us practice pediatric dentistry at various levels, and some of us often find ourselves at crossroads when we decide which space maintainer to be given in case we remove our deciduous tooth early. So today I will be discussing those things. First of all, I like to share few test cases for you all. There will be 3 cases and I want you to see each of them very carefully and probably make a note which space maintainer you feel is best. So this is the test case 1. In this, these are the missing teeth and you have to decide which space maintainer to be given. Test case 2. These are the first primary molars which will be removed. Decide which space maintainer you would like to give. Test case 3, in which this particular primary molar has to be removed. See the case carefully and decide which space maintainer you would like to give. So coming to my clinical classification of space maintainers, which could be broadly classified into removable and fixed. Removable are obviously maxillary or mandibular, while in fixed it could be maxillary mandibular depending the loss is unilateral or bilateral. In unilateral maxillary cases, a band and loop is a most commonly used space maintainer, while in case unilateral multiple loss in a maxillary arch, transpalatal arch is the preferred space maintainer. And if the same thing, it becomes bilateral, you can either give a bilateral band and loop or a nance palatal arch. Coming to mandibular, in unilateral cases it's band and loop, while if it becomes a bilateral, you might give a lingual arch. Mind you, this band and loop is usually preferred for a singular unilateral loss. If there is a multiple unilateral loss, still a lingual arch will hold good. Now let's start identifying the space maintainers. One of my favorite is a removable space maintainer, probably most easy to identify. This is a lingual arch. You can make out this is a lower arch with bilateral loss. As I said, if it is multiple unilateral loss, still a lingual arch can be given. Transpalatal arch, which has a arch transpalatally between two banded molars. Nance palatal arch, it has a nance acrylic button banded with these molars. And the most commonly and most versatile, band and loop. Band with a loop. So let me explain story of space maintainer in next 10 cases. Before deciding the space maintainer, I would like everyone to concentrate on few steps to know which is the best space maintainer for a particular case. First of all, always have a radiograph. OPG is best while deciding the dental age of the patient, and in some cases an intraoral perioapical view also does the work. Yes, the chronological age of the child is very important. You might not like to give a space maintainer in an 11-year-old kid whose first primary molar has been lost. So knowing the age of the child is very important. Yes, you need to know which are the other teeth. They are primary, permanent, incisors, canines, especially in the lower arch. You need to know in mixed dentition the incisors are primary or permanent. I will be explaining them why it is important, but yes, identify the other teeth. Yes, you have to somehow determine how cooperative is the child. Highly uncooperative child might not keep a removable space maintainer or a fixed space maintainer. Highly cooperative child might keep a removable space maintainer. I always personally feel removable space maintainers are the best, but you need cooperation for the child. So you need to use something to know how cooperative the child and the parent are, especially for home oral hygiene. As I said, removable space maintainer is always an option. I mean, you can replace all your fixed appliances with one option, removable space maintainer, but child-parent cooperation is a must for a removable space maintainer to be success. Coming to our case 1, as you see, in this case there is a single unilateral loss. Which arch it is? It is a mandibular arch. Identify the teeth. All 4 incisors are primary. So here my favorite space maintainer would be, yes, you are right, band and loop. Unilateral mandibular space loss. So a band and loop, or remember, a removable functional space maintainer. Seeing this case, this is a maxillary arch, permanent central incisors with a unilateral tooth loss. So here my appliance will be a band and loop again. A band and loop is usually the most commonly used space maintainer. Coming to case 3, identify the teeth. All primary teeth, no permanent molar yet erupted. Still we have a unilateral loss of first and second primary molar. Any guesses? Band and loop? No. Lingual arch? No, no, no. Then I feel this is a case for a removable functional space maintainer, where the distal part of your artificial E will guide the eruption of the coming first permanent molar. So I think this is a case only for a removable functional space maintainer. A distal shoe is not an option because we have already lost a D as well. Case 4, bilateral loss of multiple molars. Permanent molar has erupted. Incisors are yet primary. So, and it's a mandibular arch. So my options are lingual arch. No, you can't give a lingual arch till the permanent incisors are erupted. Bilateral long band and loops are not very stable. So I think it's a case for a removable functional space maintainer. Coming to this case, it's a very small baby. Both E is present, B is lost, incisors hypoplastic, there are almost root stumps left, and yes, it's a mandibular arch. So I feel this is a case of a removable space maintainer, but the child is too small to cooperate, so I would give a bilateral band and loops. These places. This case number 6 I have put to introduce something which is called as crown and loop. Actually I prefer a band and loop over a crown always, and this is a distinct picture to explain the difference. This is a normal band over a tooth with a loop. Here the adjacent teeth had caries or pulp therapy, so we had to give a crown, and over this crown we have put a band, so this becomes a crown and loop or a band and loop over a crown. So as I said, it's always beneficial to give a band and loop over a stainless steel crown rather than soldering your bands on the crown. Coming to this next case, this is a very interesting case. A young baby, 3-year-old, massive hypoplasia in the primary dentition. These are all root stumps, mandibular root stumps of all the teeth. On radiograph it was found that these E's are still can be saved with using pulpectomy and a stainless steel crown. So space maintainer in this case, I feel we don't have many options. It has to go for a complete removable functional space maintainer. No other options left. A difficult case. Coming to this arch, it's a maxillary arch, primary incisors, where this is already lost and this has to be removed. So it becomes a case of bilateral loss of single primary molars. Space maintainer of my choice will be a Nance palatal arch, and yes, a removable functional space maintainer always. Coming to next case, in this maxillary arch, these two primary molars have to be removed. Mind you, this is full primary dentition with just 2 E's erupted. Here you can either band these two E's and give a Nance-palatal arch, or you can also give bilateral band and loops also after restoring these canines. Last case, a maxillary crowded arch where these two stainless steel crowns, restored teeth has to be removed because their pulp therapy is failing now. So it becomes a case of maxillary bilateral single tooth loss. I would like to give a Nance-palatal arch here. So coming back to my test cases, let's see how many of us were right from the beginning of this presentation. Test case 1, see closely, mandibular arch, bilateral multiple loss, but incisors all four are not permanent. So I can't give a lingual arch here. It becomes a case of a removable functional space maintainer. As I said, because the incisors were not permanent. Test case 2, where I had to remove these two primary molars, and it became a case for a lingual arch for me because all four incisors were permanent. So a case for lingual arch. Case 3, maxillary primary dentition, single tooth loss. It's a case for, yes, you are right, it is a case of band and loop. Thank you all for your patient listening. For any further doubts, you can always leave a comment below, which I will try to respond as early as possible. Please try to send some pictures as well for easy case discussion. Thank you.